Hi, my name is Shelby Wages, and I'm going to be discussing restraints. So a physical or chemical restraint should only be used as a last resort if a patient is at risk for hurting themselves or others, and this should only be assessed by a licensed healthcare provider when deciding whether or not a patient does need a restraint. So once that's been assessed and decided, a healthcare provider would enter the room, introduce themselves, perform proper hand hygiene, ensure the patient's privacy, and then we also want to make sure that that patient is who they say they are. So we would ask them for 2 identifiers and check their wristband to make sure that that is correct. So once that's been established that that is who they say they are and that is the prescription that they need, we would want to make sure that that didn't need a consent form from the patient or a legal guardian. And then we would want to explain when and why, why and what they were prescribed. So we would discuss how those restraints would be applied and why they needed them. And so there's a few different types of restraints. The first one I'm going to talk about is a belt restraint. The belt restraint goes around the waist. So before applying any type of restraint, we want to make sure that we document the skin integrity of the area where it's going to be applied, the circulation, the pulse, the sensation, and the range of movement that that patient has in the area. So for the belt restraint, we're going to apply it at the waist. We want to make sure that it's not too high or too low. If it's applied too tightly, it could cause inhalation problems, so that's very important. And a belt restraint is used to immobilize the patient's center of gravity. It's typically used to help prevent them from falling out of chairs, beds, stretchers, things like that. And then we have the mittens. Again, you'd want to assess the area of where it's going to be applied, which is going to be over the hand, and it velcros to the wrist. So we want to make sure that we do velcro it at the wrist and not the forearm. We also want to make sure that it's applied snugly but not too tightly, because too tight could cause circulatory problems or potential neurovascular injury. So we want to make sure that we could fit 2 fingers in between the restraint and the skin there. And then we have the mummy, which is typically used for children or infants during a physical assessment. And so that's used with a mummy blanket or a sheet, and it's essentially swaddling the patient. We want to make sure that a healthcare provider does this and not a parent or a legal guardian. And then we have our wrist restraints. These are used to immobilize the arms. They could be used to help prevent falling or from removal of therapeutic devices, hurting others, scratching, irritating wounds, things like that. And so after assessing the area there, we would go ahead and apply those restraints, and there's usually a soft side that goes on the wrist. And so we want to make sure again that that's snug, but it's not too tight, because again it could cause circulatory and potential neurovascular injury. So that's very important. And then after your restraint is applied, we would go ahead and make documentation of our assessments of the skin integrity, pulse, circulatory sensation, and range of movement for before and after those restraints were applied. And then we would go ahead and make sure that a call light was in reach of the patient, and that the wheels of the bed or the chair are locked and secured. We also want to make sure that we come back and we check on the patient often, but also we should remove the restraints every 2 hours and assess whether the patient still needs it, or if the skin integrity and things like that. So now I'm going to demonstrate how to tie a slip knot for a restraint. So this is tight, it's not going anywhere, and then I can just pull here and it goes right through. So that's my video on restraints.